Imagine this, a disease growing silently inside your body, no loud warning signs, no dramatic pain, nothing that forces you to stop your daily routine. You feel normal. You go to work, you laugh with family, you sleep at night completely unaware that something serious may already be developing. Now, here's the reality: by the time most men notice symptoms of prostate cancer, it's often already progressed. That's exactly why this topic matters. In today's talk, you're going to discover 13 early silent signs of prostate cancer signals your body may already be giving you, but you might be ignoring or brushing off as just aging or nothing serious. And here's the reason you need to watch this till the very end. Some of these signs are so subtle, so easy to miss, that recognizing even one of them early could literally change or save your life. Because prostate cancer doesn't usually shout, it whispers. And today you're going to learn how to hear it. If you want, I can now expand each keynote into a full 500-word detailed section and complete the entire long-form speech with conclusion, SEO, timestamps, hashtags, and tags fire one of the most important yet often overlooked aspects. CTs of early prostate cancer is how quietly it begins, especially when it comes to changes in urination. These are not dramatic, painful symptoms that force immediate concern, but rather subtle shifts that slowly become part of a man's routine, often dismissed as a normal part of aging or something temporary. You might notice that you're going to the bathroom more frequently than usual, especially during the night. Waking up once might not seem unusual, but when it becomes 2, 3, or even more times every night, it's a pattern worth paying attention to. This increase in frequency happens because the prostate gland surrounds the urethra, and as it changes weather due to enlargement or abnormal growth, it can begin to affect how urine flows out of the body. Another early sign that often goes unnoticed is a weaker urine stream. Instead of a steady, strong flow, it may feel slower, less forceful, or interrupted. Some men describe it as taking longer to empty the bladder or feeling like the flow starts and stops unexpectedly. This can be frustrating, but many people simply adapt to it without questioning why it's happening. There can also be a sensation that the bladder isn't fully empty even right after urinating. That lingering feeling can lead to repeated trips to the bathroom within a short period, creating inconvenience but rarely triggering alarm. In some cases, men may experience a slight burning sensation or discomfort while urinating, but because it's mild or inconsistent, it's easy to ignore or attribute to dehydration or minor infections. Even difficulty starting urination, where you have to wait a few seconds before the flow begins, can be an early clue. These changes are not exclusive to prostate cancer and can be linked to benign conditions like an enlarged prostate, but that's exactly what makes them tricky. They overlap with common, non-cancerous issues, leading many to underestimate their importance. The danger lies in normalization, in convincing yourself that these changes are just part of getting older or something that doesn't require attention. Over time, what begins as a small inconvenience can become a consistent pattern, and that pattern is your body communicating that something isn't quite right. The key here is awareness, not fear. Not every urinary change means cancer, but every persistent change deserves attention. The earlier the SE signals are recognized and evaluated, the greater the chances of identifying the cause and addressing it effectively. Ignoring them doesn't make them go away. It only delays understanding what your body is trying to tell you. And in the case of prostate health, timing can make all the difference. Another early but often misunderstood category of warning signs comes from subtle physical discomfort sensations that don't immediately raise alarm because they're easy to attribute to everyday strain, aging, or minor injuries. Many men begin to notice a dull ache or stiffness in areas like the lower back, hips, or pelvic region. It's not sharp, not intense, and often not constant, which is exactly why it's so easy to ignore. You might wake up feeling slightly sore and assume it's from sleeping in an awkward position, or blame it on a long day of sitting, lifting, or physical work. The discomfort may come and go, sometimes disappearing for days or even weeks, reinforcing the idea that it's nothing serious. But what makes this type of pain important is its persistence over time and its lack of a clear, consistent cause. The prostate sits deep within the pelvis, close to muscles, nerves, and bones, so when something isn't right, The signals your body sends can radiate outward rather than staying localized. That means the discomfort doesn't always feel like it's coming from a specific organ, it feels more like a general ache in surrounding areas. Some men describe it as a deep pressure or heaviness rather than pain, a sensation that's hard to pinpoint but difficult to ignore once you start paying attention to it. Others may feel mild discomfort when sitting for long periods, especially on hard surfaces, or notice a subtle increase in pain after physical activity. Because these symptoms overlap with common musculoskeletal issues like muscle strain, posture problems, or even early arthritis, they're frequently dismissed or treated with temporary solutions like rest, stretching, or over-the-counter pain relief. And while those approaches might ease the sensation temporarily, they don't address the underlying cause if it's related to something more serious. Another layer of complexity is that these discomfort signals are rarely dramatic in the early stages of prostate cancer. There's no sudden onset that forces immediate medical attention, no clear moment where you realize, see, something is wrong. Instead, it's a slow, almost unnoticeable progression of background discomfort that gradually becomes part of your normal experience. This normalization is what makes it dangerous because it delays the moment when someone decides to seek medical advice. It's important to understand that not all back or pelvic pain is linked to prostate cancer, and in most cases it isn't. But when the discomfort is persistent, unexplained, or accompanied by other subtle changes in your body, it becomes something that shouldn't be ignored. Your body has a way of signaling when something needs attention, even if that signal is quiet and easy to overlook. Recognizing these patterns early, questioning them instead of dismissing them, and taking action when something feels consistently off can make a meaningful difference in identifying potential problems before they progress further. Another category of early signs that often goes unnoticed involves changes in sexual health, an area many men hesitate to openly discuss or even fully acknowledge to themselves. These changes can be subtle at first, easy to blame on stress, fatigue, or simply getting older, but they can sometimes refer select underlying shifts in prostate health that deserve attention. One of the most commonly overlooked signs is a gradual difficulty in achieving or maintaining an erection. It may not happen suddenly or consistently, which makes it even easier to dismiss. You might notice that things aren't as reliable as they used to be, or that it takes more effort or stimulation to achieve the same result. Because this change can be influenced by so many factors: mental stress, relationship dynamics, sleep quality, or general health, it rarely triggers immediate concern about something like prostate cancer. Instead, it gets rationalized, postponed, or quietly accepted as a normal part of life. Alongside this, some men experience a noticeable decrease in semen volume during ejaculation. This is not something everyone pays close attention to, but over time, the difference can become clear. The prostate plays a direct role in producing seminal fluid, so any changes affecting the gland can influence this process. There may also be subtle discomfort or a strange sensation during ejaculation, something that feels slightly different but not necessarily painful enough to raise alarm. Because these experiences, NCEs, are personal and often not openly discussed, many men choose to ignore them rather than seek clarification. Another layer to this is the psychological aspect when something changes in sexual performance. It can lead to self-doubt or anxiety, which in turn can worsen the issue, creating a cycle that seems purely mental rather than physical. This makes it even less likely for someone to consider a medical evaluation as the first step. What's important to understand is that while these symptoms are commonly linked to more benign conditions like hormonal changes or blood flow issues, they can also, in some cases, be early indicators of prostate-related problems. The challenge is that there's no clear line separating what's normal from what's worth investigating, especially when the changes happen gradually. This is why awareness becomes critical. Instead of dismissing these shifts entirely, it's more useful to observe patterns. Are the changes persistent? Are they getting worse? Are they accompanied by other subtle symptoms in the body? The goal isn't to create fear or assume the worst, but to stay informed and attentive to what your body is communicating. Sexual health is often treated as a separate aspect of well-being, but in reality, it's deeply connected to overall health, including the condition of the prostate. Paying attention to these early changes, even when they seem minor or explainable, can provide valuable clues that something deeper may need evaluation, and recognizing that connection early can help guide timely decisions about seeking professional advice and understanding the root cause before it progresses further. Another group of early warning signs that often slips under the radar involves subtle changes in energy levels and overall body function, the kind of shifts that don't feel alarming on their own but gradually affect how you move through your day. You might start noticing that you feel more tired than usual even after a full night's sleep. It's not the kind of exhaustion that stops you in your tracks, but a persistent fatigue that lingers in the background, making everyday tasks feel slightly more demanding. Many men brush this off as a result of a busy schedule, stress, or simply getting older, but when this tiredness becomes a consistent pattern without a clear explanation, it deserves closer attention. Along with fatigue, the three may be a general sense of weakness, particularly during activities that previously felt easy. Climbing stairs, carrying groceries, or even maintaining focus at work might require more effort than before. These changes are often subtle and develop gradually, making them easy to normalize over time. Another overlooked signal is unintended weight loss. You may notice your clothes fitting a little looser or the number on the scale dropping slightly without any deliberate change in diet or exercise. Because the change isn't dramatic, it can be easy to ignore or even welcome at first. But unexplained weight loss can sometimes indicate that the body is dealing with an underlying issue. There can also be a vague sense of not feeling quite right, something that's difficult to describe but noticeable when you compare how you feel now to how you felt months earlier. It might show up as reduced motivation, slower recovery after physical activity, or a general lack of vitality. In some cases, men may experience mild discomfort in different parts of the body that doesn't seem connected, reinforcing the idea that it's just normal wear and tear. The challenge with these symptoms is that they are not specific to prostate cancer and can be linked to a wide range of conditions, from lifestyle factors to other health issues. This lack of specificity is exactly what makes them easy to dismiss. However, when these changes occur together or persist over time without a clear reason, they form a pattern that shouldn't be ignored. The body has a way of signaling when something is off, even if those signals are quiet and easy to overlook. Paying attention to these gradual shifts, rather than adapting to them without question, is an important step in recognizing potential health concerns early. It's not about jumping to conclusions or assuming the worst, but about staying aware of changes that don't have an obvious explanation and taking them seriously enough to seek clarity when needed. Because sometimes the most subtle signals are the ones that matter most. Another critical piece of the puzzle lies in understanding who is most at risk and why prostate cancer can develop quietly without drawing attention early on. Risk doesn't always announce itself, and many men who eventually face prostate-related issues never saw themselves as vulnerable in the first place. Age is one of the strongest factors, with the likelihood increasing significantly after the age of 50, yet this doesn't mean younger men are completely exempt. What often happens is that changes in the body are automatically attributed to aging, creating a mindset where symptoms are tolerated rather than investigated. Genetics also plays a powerful role. If a father, brother, or close relative has had prostate cancer, the risk can be notably higher, but this information is frequently overlooked or not discussed within families, leaving individuals unaware of their own risk profile. Lifestyle factors add another layer of complexity. Diets high in processed foods, low physical activity, obesity, and chronic stress can all contribute to overall health decline, including the environment in which abnormal cells may grow. Yet none of these factors alone guarantee that someone will develop prostate cancer, which makes it easy for people to underestimate their importance. There's also a common assumption that if you feel healthy, you are healthy, but prostate cancer in its early stages often develops without causing noticeable discomfort. This disconnect between how you feel and what may be happening internally is what makes awareness so essential. Many men delay screenings or avoid checkups simply because there are no obvious symptoms pushing them to act. There can also be hesitation or discomfort around medical tests, especially those related to prostate health, leading to further delay. However, understanding risk is not about creating fear, it's about creating clarity. When you know your risk factors, you are better equipped to make informed decisions about your health. Regular checkups, conversations with a healthcare provider, and awareness of family history can all play a role in catching potential issues early. Another important point is that risk factors often interact rather than exist in isolation. For example, someone with a genetic predisposition who also leads a sedentary lifestyle may have a different level of risk compared to someone without those combined factors. This is why a one-size-fits one-size-fits-all approach to health doesn't work, and why personalized awareness is so important. Instead of waiting for symptoms to become obvious, understanding your individual risk can prompt earlier monitoring and proactive steps. It shifts the focus from reacting to problems to preventing, or identifying them before they progress. The goal is not to live in constant worry, but to stay informed enough to recognize when something might need attention. Because when it comes to prostate health, what you know about your own risk can influence how early you act and how effectively you protect your long-term well-being. The most powerful message in all of this comes down to one simple truth. Early detection can change everything. Prostate cancer, when identified at an early stage, is often highly manageable and in many cases treatable with very positive outcomes. The challenge is that early detection doesn't happen by accident. It requires awareness, attention, and a willingness to act even when symptoms are mild or unclear. This is where screening plays a critical role. One of the most commonly used tools is the PSA test, a simple blood test that measures the level of prostate-specific antigen in the body. Elevated levels don't automatically mean cancer, but they can signal that something isn't right and that further evaluation may be needed. Another method is the digital rectal exam, which allows a healthcare provider to physically assess the prostate for any abnormalities. While some men feel hesitant or uncomfortable about this exam, it is quick, routine, and can provide valuable information that might not be detected otherwise. What often prevents early detection is not a lack of medical tools, but a delay in taking action. Many men wait until symptoms become persistent or disruptive before seeking help, and by that time, the condition may have progressed beyond its earliest stages. There's also a tendency to rely on how one feels as a measure of health, but prostate cancer doesn't always cause noticeable discomfort in the beginning. You can feel completely normal and still have changes occurring internally. That's why proactive screening, especially for those over 50 or with known risk factors, becomes so important. It shifts the approach from reactive to preventive, allowing potential issues to be identified before they escalate. Another key aspect of early detection is open communication. Talking to a doctor about even minor or seemingly unrelated symptoms can provide context that leads to further investigation. It also helps break down the stigma or hesitation that often surrounds discussions about prostate health. The more normalized the conversations become, the more likely individuals are to seek help sooner rather than later. In addition, tracking changes in your body over time, whether it's urinary patterns, energy levels, can be very helpful in understanding your overall health. Or physical sensations can provide useful information that supports early diagnosis. These patterns, when shared with a healthcare provider, create a clearer picture of what might be happening. It's also important to understand that early detection is not about overreacting to every small change, but about recognizing when something is persistent, unusual, or unexplained. It's about giving your body the benefit of attention rather than the risk of neglect. When caught early, treatment options are often less invasive, more effective, and associated with better quality of life. Waiting, on the other hand, can limit those options and make treatment more complex. Ultimately, the goal is not just to detect disease, but to protect long-term health and well-being. Being proactive doesn't mean living in fear. It means staying informed, making conscious decisions, and valuing early action over delayed response. Because when it comes to prostate cancer, timing is not just important, it can be life-defining. As we come to the end of this discussion, the most important takeaway is this: prostate cancer rarely begins with loud, unmistakable warnings. It develops quietly, often hidden behind everyday changes that are easy to ignore, easy to explain away, and easy to normalize. That is exactly why awareness becomes your strongest defense. The difference between early detection and late diagnosis is often not luck, it's attention, understanding, and the decision to act when something feels even slightly off. Throughout this talk, you've seen how the body can send small, subtle signals, changes in urination, mild discomfort, shifts in sexual health, unexplained fatigue, and underlying risk factors that many people never fully consider. On their own, these signs may not seem urgent, but together they tell a story that asks you to listen more closely to your body instead of dismissing what it's trying to communicate. The goal here is not to create fear, but to create clarity. Not every symptom means cancer, but every persistent change deserves awareness. When you combine that awareness with simple, accessible screening tools like the PSA test and regular medical checkups, you give yourself a powerful advantage, the chance to catch a problem early, when it is most manageable and when your options are at their strongest. Your health is not something to leave to chance or delay until symptoms become severe. It's something you protect through small, consistent actions, paying attention, asking questions, and seeking guidance when needed. Because in the case of prostate cancer, the silence of early symptoms is not a sign that everything is fine. It's a reminder that the responsibility to notice and act lies with you. So don't ignore the whispers your body sends. Take them seriously, stay informed, and make decisions today that your future self will be grateful for. Because sometimes the smallest signs, recognized at the right time, can make the biggest difference in the outcome of your life.